Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest is Dr. Ethel Siris. She's here today to talk with us about osteoporosis and hopefully clear up some misconceptions, talk about some of the latest advances, and basically give us a deep look into this disease. Welcome to Health Professional Radio, Doctor.
Thank you very much. Happy to be here.
Give our listeners a bit of your background. Have you always been interested in osteoporosis?
Right. Well, I'm trained as an endocrinologist, and I've been working in this field for many years now. Sometime in the mid-1990s, we began to have ways of estimating people's bone densities, which turned out to be a useful way of seeing who is at risk for future fractures, which is what osteoporosis is all about. So for the past 20-plus years, I've been involved in some of the things that have happened to help us diagnose the condition and also how to treat it so that people who have osteoporosis are less likely to break bones.
Now, is this something that affects people who are up in years, or can osteoporosis affect a person no matter where they are in life?
Generally speaking, when we talk about the 2 million fractures that occur in this country every year related to osteoporosis, we're talking about fractures that occur after the age of 50. Okay. But there are lots of things that go on in our lives before we get to 50 that impact on the amount of bone we make and on the quality of that bone. And then after age 50, what happens to the bone we have that can lead to a weakening of that bone and a lessening of the amounts such that older people who fall down may break something.
You mentioned things that we do prior to age 50. What, in your opinion, is the one thing that we can do prior to age 50, whether it be nutritionally or exercise or what have you, that can lower our propensity to get osteoporosis later on?
Well, by the time you're 30 or so, you've built as much skeletal mass. You've built as big a skeleton as you're going to get based on your genetics. I think before you get to 50, what you want to do is lead a clean life. And by a clean life, what I mean is don't smoke. One of the things that's bad about cigarettes has to do with bone. Don't drink in excess. And excess is defined in our field as 3 alcoholic drinks a day or more. And stay physically active. Obviously, a big part of the fractures that occur in the later years of life are a consequence of falling on a weakened bone. So one of the big components of not breaking bones later is to be as strong as possible in terms of your muscles, your balance, your coordination prior to getting older. And I think it's difficult for a 78-year-old with osteoporosis to suddenly start exercising. But if you've been physically active from your childhood or adolescence and you remain physically active, I think that serves you well as you get into your older years. So leading a clean life and getting adequate calcium from food, ideally, dairy foods, and making sure that you're not vitamin D deficient, those are the things you want to do prior to getting into your 50s.
So are you saying that osteoporosis is preventable if we do certain things?
Well, osteoporosis means that you have bones that are weak enough that they may break with minimal trauma. It's the fractures that we're really trying to prevent. Some people are going to build a small skeleton because that's genetically what they're programmed to build. And in a woman, after menopause, she will lose bone. We have certain cut points for the amount of bone that we call normal, low, or frankly osteoporotic. We can certainly prevent postmenopausal or age-related bone loss so that people's bone densities don't go way, 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 way down. But most importantly, we want to prevent fractures associated with low bone mass or frank osteoporosis. And that's where it's a combination of medication, if appropriate, finding ways not to fall, and making sure that your calcium and vitamin D sufficient. We're not telling people to take extra, but we want to make sure that people are getting enough. And as I said, calcium-rich foods are a great way to get the calcium. Vitamin D is trickier because when you're younger, sunshine will give you the vitamin D that you need. As you get older, you may need to take a supplement of vitamin D if your level is too low because it's harder to make it as you get older. So yes, osteoporosis per se, meaning a very low score, is preventable if you pick up the fact that somebody is losing and approaching that level of low bone mass. But most importantly, we want to prevent the fractures associated with low bone mass or osteoporosis. Lots of people are going to have low bone density. And we want to pick those people up, find out who they are, and then work very hard to prevent the fractures that they are at risk for sustaining.
When you're talking about fractures, are we talking about those that result from a fall on weakened bone, or maybe fractures that, excuse me, aren't necessarily that visible or cause that much of a problem? Say, you step wrong on a step, or maybe step too hard on weakened bone, and you've got a hairline fracture somewhere in there. Is that something that is going to cause future problems? Or once you have been diagnosed with osteoporosis, are even the smallest fractures harder to heal, or is the healing a factor at all?
Generally, healing is not the problem. When we talk about osteoporosis-associated fractures, we're talking about major breaks from minor falls. And what we mean by that is the most terrifying fracture for an older person is a hip fracture. That involves being hospitalized, usually having surgery, then winding up in rehab, sometimes in a nursing home, having a hard time learning to walk again if you're old enough. We're also talking about pelvis fractures, shoulder fractures, wrist fractures, pretty much any bone, but the big ones are the ones I just described. And of course, very importantly, spine fractures. Spine fractures can occur lifting something way too heavy. Most of the other fractures occur in the setting of falling from a standing height. I'm not talking about falling off a cliff. I'm talking about standing up, tripping, falling down. You can break bones in your back. You can get spine fractures from a fall or from lifting something too heavy. But most other fractures are associated with falling. I think that any broken bone can be highly annoying, but the fractures that I'm describing are disabling. They're the kind that require a period of management, often by an orthopedic surgeon, where you have to recover function after the loss of function. Even something like a wrist fracture can leave you with a wrist that is not as flexible as it once was, can leave you with chronic discomfort in the wrist even after it heals. So what we're trying to do is prevent fractures that impact very negatively on quality of life over the short and sometimes over the longer term. Many of these fractures in older people lead to a terrible fear of falling, and people psychologically are uncomfortable going out of the house. They're terrified of falling. It's something that can spoil the third of life that is after menopause if you're a woman, and it can certainly interfere with enjoyment of life in both men and women. So it's important to try to prevent the major fractures.
Now, when it comes to determining whether or not a person has osteoporosis, what are some of the tests that are involved? And is this something that is done routinely when you walk into the office if you're of a certain age, or if you're of a certain age and have a fracture? Is a test for osteoporosis the norm, or is it something that has to be requested specifically?
You're asking a fantastically good question. Medicare has recommended that if you're a 65-year-old woman or a 70-year-old man and you've never had a bone density test, and by a bone density test I'm talking about a non-invasive, painless, easy test that you can set up through your physician, where they scan over your spine, portion of your spine, they scan over the hip area, and in some cases also the forearm. And this is the standard way, this has been the standard way up until quite recently for making a diagnosis of osteoporosis, because when you do a bone density test, which is, as I said, is recommended for everybody, if you're a woman after 65, if you're a man at 70 or over, this is supposed to happen in everybody, and it doesn't. That's the first thing. If you're a postmenopausal woman less than 65 or a man between 50 and 70, and you've got a major risk factor for future fractures, meaning you have a medical condition that may predispose you to have bone loss and fractures, or if you're on one of a number of medications that may lead to fractures, you're supposed to have the test. The way the test works is it's given a score, and the score is called a T-score. If your T-score is between 0 and -1, your bone density is normal, and you're called normal. If it's between -1 and -2.49, it's called low bone mass or osteopenia. This is not a disease. This is just a low score. If it's -2.5 or lower, and it can get much lower, believe me, that's called osteoporosis. And for a long time, that was the sole way of making the diagnosis. Recently, a task force that I chaired, coming out of the National Bone Health Alliance, expanded or recommended strongly that we expand the diagnosis opportunities to, yes, continue to do bone density if that's the way it's diagnosed, but If your bone density, and again, we're talking about postmenopausal women and older men, if your bone density is low, but not frankly osteoporosis, but you've already had a fracture of the spine, the shoulder, the pelvis, and in many cases the wrist, your clinical diagnosis is osteoporosis. Similarly, if you break your hip in this age range, we don't necessarily need a bone density to tell us you have osteoporosis. You have it. And finally, there's a risk tool that came out of the World Health Organization called FRAX. And in the United States, when we do this little calculation, which is very easy to do, it combines risk factors, which are well validated, with your hip density score. If your predicted fracture risk for the next 10 years exceeds certain cut points, we're going to call that osteoporosis because you're at high risk.
Okay.
So we now have multiple ways of making the diagnosis, and probably anybody who sustains a fracture after 50 should have the bone density. If the fracture occurred during a train crash, it could be the train crash. It could also be that it was a train crash in which a person with terrible bones broke a bunch of them. So you need the test. If the bone density test is terrific in that setting, you don't get too upset about it. You say, great, your bones are not bad, but you may find somebody has low bone density. And of course, if any of these ways of making the diagnosis suggest that you're at high risk for fracture, you have osteoporosis and you need to be treated to prevent fractures.
What is the biggest misconception, in your opinion, in your experience, that you want to dispel among our listeners today?
Okay, very quickly. The three things you have to do to prevent fractures are not be calcium or D deficient, take medication as appropriate, and be strong, exercise so that your muscles will be strong to prevent falls. The biggest misconception, in my opinion, is that the medicines that we use carefully and for specific blocks of time, somehow or other are dangerous. They are not dangerous. Used correctly, the medicines that are approved by the FDA to prevent fractures are generally very well tolerated and remarkably safe. There are rare side effects people should know about, but in most cases, if you need one of these drugs, the benefits you will get greatly outweigh any potential risks from side effects. And people should be open-minded and willing to accept medication if it's going to make a huge difference in their lives in a positive way.
Right. And where can our listeners go, other than our physician, to get just a bit more information about osteoporosis?
A wonderful website, www.NOF.org. NOF is the National Osteoporosis Foundation. It's just a terrific website with loads of good information, which I strongly recommend.
Well, it's been a pleasure talking with you this afternoon, Doctor.
Thank you very much. Appreciate the time. Bye-bye now. Bye-bye.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Ethel Siris from Columbia University, a leading expert in osteoporosis, talking about testing, treatment options, and some of the myths and misconceptions surrounding osteoporosis. Transcripts and audio of this program are available at healthprofessionalradio.com.au. You can listen in on SoundCloud and download. You can subscribe to this podcast on iTunes. You can also go to hpr.fm.